let's talk about the three pieces of legislation that you're talking about introducing to improve patient safety and start there. So a patient safety charter, ending mandatory overtime, starting with frontline nurses, and legislating staff to patient ratios. Three of the big highlights. The nurses, the ending mandatory overtime is something that I want to start with, because as you just heard, there's some criticism that you'll be able to while the union welcomes it. You're saying that what's key to that being successful is needing to manage time better. So how have you come to the conclusion that this will be successful, ending the mandatory overtime?
For the first 2 years in government, we've added 3,500 frontline staff, and there's more than 1,200 new nurses there. We're spending more money on healthcare than ever before. So the resources are there. It's just about using it correctly. And the nurses, the healthcare aides, the physicians, they're all doing an amazing job. They're all frontline heroes. We just need to push the management, the people running our health authorities, to properly allocate the resources to where they're needed. So we didn't do this on day one because we knew we needed to add the staff first. But now that we're a couple years into that, we've seen the numbers increase in a very positive way. Now we're going to put those standards into place, and we're going to ask management to hit those targets. And again, this isn't about anything other than trying to make your care better, because we want the nurse or the healthcare aide, healthcare professional working with you to be able to have good work-life balance, to be able to recharge. You know, the thing I always point to is none of us would get on a plane if the pilot had been forced to work back-to-back shifts. So why would we say that that's okay when we go to the emergency room, that a nurse had been forced to work back-to-back shifts?
How soon will these change? Will frontline nurses see these changes?
Well, we'll start rolling it out in the coming year. So we're in the legislature this fall, resuming after the holidays in the spring session. And so we'll be bringing these legislative changes forward.
If misallocation of staff is the issue here, if you're saying there's enough people now that we don't have to, as you heard the concerns, even coming from the union, that, 60% of new nurses leave the profession within 2 years. And there's fear from the union, while they see it as positive, that we're going to have...
We've only been in power for 2 years.
Well,
so you have to consider the fact that we've changed the attitude towards recruitment and retention. We have a recruitment and retention office. So again, you're looking at backward statistics that point at the PC time in office.
Okay.
We're trying to send a message to the front lines. You want more help at the bedside to take care of these patients that you care for? Great. We're going to deliver them. You want more work-life balance? We're going to implement that into law.
I guess if even you have the union, though, saying that it is... a positive idea, but that they're worried that things will be empty, that we're going to have healthcare facilities that don't have staff.
So. No.
So tell me why you don't think so, because they're saying we don't have the numbers yet.
No, we do have the numbers. Again, more than 1,200 new nurses. This is what everyone's been asking for a long time. So we got the numbers. That's not in question. And, you just look at a nurse, you look at a doctor, you look at a healthcare professional. They care about their patients. They're not going to let somebody fall through the cracks, right? The issue is the hospital administration. We've been giving them all the money. We've been giving them all the staffing resources. We've been giving them the direction. It's time for them to show results. So we love the front lines, but this is really about the management of our hospitals and regional health authorities. They have to start showing improvement. How
will you crack down then on what is you're alleging mismanagement, really misallocation of staff? If they're the solution, how will you set targets or timelines for how they have to achieve with existing staff what you're hoping to achieve?
Yeah, exactly. First and foremost, it's that patient safety charter. You go to the emergency room, God forbid, but you go to the emergency room to get help, to get well. And so we want to outline what you should expect there, first and foremost. And then in terms of you getting that safe, healthy care for you, you need good staff to deliver that. And that's where those other two pieces come in. One is ending the mandatory overtime so that nurse has not been run off their feet on 2 back-to-back shifts, or the healthcare aide or healthcare professionals. And the other is staff-to-patient ratios in priority aspects of the healthcare system. So when we can bring that into place, that's going to guarantee, in the emergency room, you're in the ICU, there's going to be enough staff there to take care of you instead of having people spread too thinly. So we did the first steps around educating, retaining, recruiting staff. We have many, many more people in the system now. And now we're sort of pressing forward on making sure that the administration deploy those people into the right areas. And again, rather than forcing frontline people, like how mandating overtime was being used, we're going to put the incentives, we're going to put that overall structure into place so that people would voluntarily step up, and we'll get the staffing outcomes that we want to see, and you'll get the health care that you need.
So we'll watch where those open spaces are, and by the numbers, if the reallocation will work and such. Let's move to grocery prices. I know you're going to study reducing grocery prices. You've committed actually to reducing grocery bills this spring. What are some ways that a provincial government can affect change there?
Well, we'll roll those out in the spring budget, some specific details. We all see what's happening with the price of groceries. And so I think the first step is just to make sure that the steps that we're going to take in these budget measures are going to be the right ones that will actually make a difference for consumers. There are, like, a provincial government can't do everything, right? Like
you can consider removing the PST from grocery store bills. Is that where we're leaning? Is that where we're going?
You'll see the specific details on budget day.
Is that something you're considering?
Well, I think when we look at the gas tax cut, that put money in people's pockets. That stopped runaway inflation in Manitoba. So, my left-wing economics profs are not going to like this, the fact that I was their student 20 years ago or whatever, but the reality is you cut a consumer-facing tax, it helps people. And so, that's certainly one thing we'll look at. But
so I need to confirm this as a journalist. The PST is on the table?
Well, I think the first thing that we're announcing here is a study, because who are the large players? Do we have enough competition amongst those big chains?
Okay.
I was there 6:30 in the morning. A lot of excitement at the new Costco. People are serious about saving money. People are serious about competition in the grocery store. So that'll be one thing we look at. You got the independents, the local grocers. We want to see what's going on there. Are there things with our distribution system? We do a lot on the ag side too, freezing ag crown land lease rates for beef producers. We've seen what's happening with the price of beef. We're trying to do what we can at the provincial level to control the costs that are the inputs for the beef producers.
So there's a number of measures.
It's going to have to be a comprehensive approach. Yeah, it's a big challenge for
more
people.
Details in the spring. I know you dodged the tax question here, so I won't ask it a third time. That's okay. You are pushing ahead with a supervised consumption site. We've heard some reaction in the news this morning. I want to look at another perspective.
Okay.
Many welcome this. But you also know that, the first proposed site that you looked at, people weren't happy about that. You're moving it somewhere else in the downtown. People may only get days notice before it opens in the new year. What about someone who's worried the facility won't belong in their neighborhood?
Well, I think everyone knows where the facility is going to go. I mean, you drive up Main Street and you see a humanitarian crisis. It's just awful, the way folks are living out on the street. And you got the Salvation Army, you got Siloam Mission, you have Main Street Project. So it's pretty clear that that's where the need is. And so where do we locate a facility in that general area, but it's not going to be right across the street from a school or a childcare center? That's what we've been working on. But we've done a lot of outreach. We campaigned on this. This is a well-known thing that the addictions medicine doctors tell us is one of the tools. Again, it's not a silver bullet, but it's one of the tools that can help save lives. So we're investing in recovery. We gave all the media a tour of the Sobering Center earlier this week, so that's a part of the solution too. We have enforcement, we have prevention, we have other forms of harm reduction, and now this is one more tool that we can add to that comprehensive approach to just try and help people get well. And you know what? The idea of supervised consumption is one part of it, but part of it is also just getting people health care. If people are living a high-risk lifestyle where there's drug use, where there's needles and stuff like that, they need to see a doctor. They need to see a nurse practitioner. And so connecting them with those services as well as talking to them about recovery and treatment is part of the mission here.
In your view, if there are still people that are worried about having something like this in their neighborhood, and I'm not just pushing at the not in my backyard thing, but what my question to you is, what don't they understand about the impact then? If it's not going to be an issue, what would you say you would like?
I think people are smart. I don't know that it's that they don't understand. What I would just say is this doesn't happen in a vacuum, right? The alternative to having a supervised consumption is to have unsupervised consumption in the street. That's the alternative, because that's what we have now. I prefer to have, this behavior that's causing harm I prefer that having that behind closed doors under the supervision of medical professionals instead of us all driving by it on our commute home from work.
8:23 a.m. Premier of Manitoba Wab Kinew is here a day after the throne speech. So we're going through multiple topics today. Yeah, lots of stuff.
Thank you, by the way.
Okay, let's talk about what you announced about opening a natural gas power plant. This would eventually be run on renewable methane. It's projected to cost $3 billion. Some might be wondering and trying to understand why not invest that money in another hydro dam?
Well, because the hydro dam will take 20 years is the short answer, and we need energy today. This is really about Trump-proofing our economy in a couple big ways. One, we are starting to see the impacts of the tariffs. And yeah, there are tariffs from China as well, too. So this is a complicated international situation. So how do we as government counteract that impact of the tariffs? Well, one of the ways is let's get to building stuff. So a $3 billion construction project in the Brandon area, that's a lot of jobs. That's a lot of hard hats and steel toe boots. That's a lot of tradespeople going to work, building something that we actually need, which is power. And that comes to the second point of Trump-proofing our economy. During the coldest days in the winter to heat our homes, we routinely import power from the States. And given what's happened with that trade relationship for the long-term security of our province, we don't want to be dependent on heating our homes based on what's happening in America. So this helps us on two fronts. It helps us with the energy security, and I'd extend that to actually say sovereignty, just to be independent of the states, and then it helps us with the economy.
I know that you have said that you hope the facility will eventually be fueled with cleaner renewables. Why not now?
The hydrogen industry does not exist in Manitoba. So that's the first alternative fuel. And then the second is renewable methane, which there is an early stage proponent, I should say, in the Brandon area working on renewable methane. So that one might actually come online relatively soon. Like not overnight, but like in the next, 3 to 5 years type of thing.
How much are you still exploring wind power here?
Oh, we're building wind. Like no question. Actually, in January, Manitoba Hydro will be announcing the first tranche of people they're going to work with on standing up new wind farms. And just as a reminder for folks, 600 megawatts of wind, that's about 4 times the capacity of wind we have in the province right now. So we're dramatically expanding wind power, but it's just to have that security, to have that economic boost, we got to do these combustion turbines as well too. And so it's about Trump-proofing the economy and making sure we got the energy we need to grow.
I want to play you a clip, actually. This is as we turn our attention to Churchill.
Yep.
Obviously, you and Prime Minister Carney met this past weekend. But we did hear from Suyik Au yesterday on CBC, Associate Producer of Finance with the U of M, University of Manitoba. Here's what he had to say about the Churchill project right now.
Okay.
We're competing against very large cities and very large projects, which have clear stakeholders that are pushing it. And Manitoba is kind of the middle child of Canada, where, we're not the biggest, we're not the most sophisticated, we're not the most athletic. We're the little middle child that gets ignored. And so we need to be able to step up and try and make ourselves a priority by having Wab Kinew and the MPs in our province speak as loudly as possible for the importance of actually pushing infrastructure like the port.
And pardon me, because I misspoke there, associate professor, not associate producer.
He lost me at the start when he was saying we weren't sophisticated, but then he got me back on at the end when he was being complimentary.
So,
not athletic. Hey, what did we do to him? Come on.
Let me ask you this. So you meet with Mark Carney this past weekend. I know there's a lot of talk about Churchill.
Yeah.
He reaffirmed the commitment to the port expansion, but the reality is we're not on the list. I mean, we had 2 lists now.
I don't know why everyone keeps saying that.
Well, the major projects list came out, and if you look down at what's on them,
well, look at the first one. We're on the list. They announced 11 projects, and we're on the list. We've been working with the Major Projects Office for several weeks, actually.
Churchill's not on the list, but
No, it is. Churchill Plus is in the first list of projects announced.
Churchill Plus
yes.
is compare that, Premier, for us to Churchill the Lines and enlighten us.
No,
then.
there's only
the
one
whole
Churchill
thing
project.
The whole thing is on the list then.
Go back to Prime Minister Carney's announcement of the first tranche of major projects in September. Churchill is part of that list. So we, since then, to explain this, we've been working with the Major Projects Office in Calgary to define the opportunity and to make sure that all the legwork is getting done. When the Prime Minister was here, we specifically announced a feasibility study on ice-breaking capacity. This is going to be kind of the crucial turning point, I think, in making this opportunity become real, take off to the next level. It's figuring out what kind of icebreaker do we need to expand the shipping season. Because if we can take the shipping season and grow it much longer, then all of a sudden the exporters are going to line up. And so this is a really important priority for us. We've been working with the Arctic Research Foundation on the icebreaking capacity. We've been working on the marine conservation area to ensure that we grow the shipping season and the increased tanker traffic while still looking out for the beluga and the polar bears. Maybe next time the Prime Minister comes, we'll put up a banner saying Churchill is on the list.
It's under the list
the
of
work
projects
is happening.
It's under the list. Everyone's saying it because it's on the list, Premier, of what's under consideration. That came out, the Churchill Plus in future. But we did all of the reporting at the beginning. I mean, we looked. If you look at the list, Manitoba's not on either of these lists officially.
It's in the first list, and we're again. So what does the list mean? The
Well,
list means that you work with the Major Projects Office, right?
The
We're
list
working
means that
with the Major
officially this is
Projects
happening
Office.
and going to be a priority. Our understanding, and if that's not your understanding, that's more critical. It doesn't matter what I think.
Yeah, we're working with the Major Projects Office, and we're building up Churchill. So again,
You consider
the media
us on the list in the same way as like the Red Chris Mine in BC and all
open
these.
open is Instagram. Like, what does his Instagram
Yeah.
say this Monday or Sunday whenever he was here? It says, I want the Port of Churchill built.
So the folks in Churchill who are listening, what's the next first phase of what will happen then out of the
It's the
out
icebreaking
of that?
capacity study that we're doing this winter. Again, for a long time, people have said you need like a multi-billion-dollar ship to open up the sea lane. But I think some of the more recent information we've been getting is it's probably not to that extent, because
Okay.
this is not multi-year ice we're talking about. This is ice that opens up during the summer months, and so it seems like if there's a much more affordable icebreaker that we could get in northern Manitoba, that reality becomes a lot closer, and that's pretty exciting for the province.
Thank you for being here.
Yeah, thanks for having me back.
Lots to analyze on our website this morning. Throne speech yesterday. Premier Wab Kinew live in our CBC studio.